Massachusetts Suboxone Doctor. In Massachusetts, Suboxone doctors can help you overcome your opioid addiction. It is essential to do your research before choosing the right doctor for you. In this video, we will discuss the signs that you or a loved one may be suffering from opioid addiction and the benefits and success rates of Suboxone and medication-assisted treatment. We'll also provide tips for choosing the right doctor and what to expect during your treatment. If you're ready to find a Massachusetts Suboxone doctor now, we can help. Suboxone is a medication used to treat opioid addiction. It is a combination of two drugs, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist, which activates opioid receptors in the brain but produces a weaker effect than full agonists such as heroin or OxyContin. Naloxone, on the other hand, is an antagonist which blocks the effects of opioids. Suboxone is used in medication-assisted treatment for opioid addiction. It helps reduce cravings and withdrawal symptoms and to prevent relapse. Suboxone is typically taken as a sublingual film or tablet, which dissolves under the tongue. It can also be taken as a subdermal implant placed under the skin. The implant releases buprenorphine for up to 6 months. Suboxone is a Schedule III controlled substance, which means it has a lower potential for abuse than Schedule I or II drugs. It is an accepted medical treatment in the United States. Suboxone treatment must be initiated by a certified physician and can only be prescribed for up to 1 year. Schedule III drugs like Suboxone have the following risks and benefits. The drug has a moderate to low potential for physical and psychological dependence. The abuse of the drug may lead to limited physical or psychological effects. The abuse of the drug may lead to moderate or low physical dependence or high psychological dependence. Suboxone is part of a comprehensive treatment plan that includes counseling and other support services. It is not a cure for opioid addiction, but it can help with withdrawal symptoms and cravings, making it easier to stay in treatment and recover. Opioid addiction is a serious and growing problem in the United States. According to the National Institute on Drug Abuse, more than 2 million Americans suffer from opioid addiction, and overdose deaths continue to rise. While opioids can be effective painkillers, they are also highly addictive. If you or a loved one is taking opioids, you must be aware of the signs of addiction. One of the most common signs of addiction is a change in mood or behavior. If you or someone you love uses opioids, you may notice them withdrawing from friends and family or engaging in risky behavior. They may also seem more tired or depressed than usual. Another sign of addiction is a change in appearance. People addicted to opioids may lose weight, have circles under their eyes, or wear long-sleeved shirts even in warm weather to hide needle marks. Other signs include changes in sleep patterns, such as sleeping more or less than usual, changes in appetite, changes in school or work performance, missing money or valuables, sudden changes in friends, a decrease in participation in activities that were once enjoyed, secretive or isolated behaviors, mood swings, neglection of responsibilities, weight loss, constipation, damaged teeth and gums, respiratory problems, worsening mental health disorder. Getting help as soon as possible is critical if you notice these changes. Opioid addiction is a serious problem that can be fatal if left untreated. However, many resources are available to help those struggling with addiction get the treatment they need. If you or someone you know is struggling with opioid addiction, don't hesitate to contact us. We can help you find the resources you need to get treatment and start on the road to recovery. If you're struggling with an addiction to opioids, you may wonder if Suboxone is the proper treatment for you. Suboxone is a medication that can help people recover from opioid addiction. It reduces cravings and withdrawal symptoms, making it easier for people to stick to their recovery plan. Suboxone is not a miracle cure for opioid addiction, but can be an essential part of treatment. If you're considering Suboxone treatment, you must talk to your doctor about whether it's right for you. There are a few things to consider before Suboxone treatment, such as whether you're pregnant or breastfeeding, your other health conditions, and other medications you are taking. Your doctor will also want to ensure that you're committed to making lifestyle changes that will support your recovery. If you're ready to take the first step towards recovery, talk to your doctor about whether Suboxone is right for you. Medication-assisted treatment, or MAT, is a comprehensive approach to treating addiction that includes the use of medication along with therapy and counseling. MAT has been particularly effective in treating opioid addiction, and as a result, it has become an increasingly common treatment option in recent years. The most commonly used medication in medication-assisted treatment, or MAT, is Suboxone, a partial opioid agonist that helps reduce cravings and withdrawal symptoms while blocking the effects of other opioids. In addition to Suboxone, other medications may also be used in MAT, depending on the individual's needs. However, all MAT programs aim to help individuals recover from addiction and achieve lasting sobriety. Suboxone and other medication-assisted treatments, or MATs, have been highly effective in treating addiction. Studies have shown that MATs can increase the success rate of addiction treatment by up to 50%. That is because MATs help to detoxify the body and reduce withdrawal symptoms. Additionally, they can help improve mental function and reduce cravings. As a result, MATs provide a comprehensive approach to treating addiction. However, it is essential to note that MATs are not a replacement for therapy or other forms of treatment. Instead, they should be part of a comprehensive treatment plan. If you or someone you know is struggling with addiction, please don't hesitate to reach out for help. There are many resources available to you. If you are struggling with opioid addiction, you may consider Suboxone treatment, which can help reduce cravings and withdrawal symptoms, making it an effective tool for recovery. However, finding the right Massachusetts Suboxone doctor can be a challenge. Here are a few tips to help you choose the right Suboxone doctor in Massachusetts. Ensure that the doctor is licensed to prescribe Suboxone. Only doctors who have completed specialized training are allowed to prescribe this medication in Massachusetts. Check if your insurance plan accredits the doctor. Many insurance plans will cover at least some of the cost of Suboxone treatment. Consider the location of the doctor's office. If you are considering outpatient treatment, you will need to be able to travel to the office for regular appointments. Ask about the experience of the staff. The staff at a Suboxone clinic should be knowledgeable and helpful. They should also be able to answer any questions you have about treatment. Choosing the right Massachusetts Suboxone doctor is essential for successful treatment. By following these tips, you can be sure that you find a doctor who is right for you. Suboxone is taken as a tablet or film placed under the tongue or inside the cheek. It is essential to follow the instructions of your doctor or pharmacist when taking Suboxone, as it can be dangerous if not taken correctly. The usual starting dose is 1 tablet or film per day. The dose may be increased depending on how you respond to the medication. Treatment with Suboxone typically lasts for 12 weeks, although some people may need to take it longer. During treatment, you will likely have regular checkups with your doctor to monitor your progress and ensure the medication works correctly. If you have any questions or concerns about your treatment, speak with your doctor. At SuboxoneDoctors.com, we understand that deciding to seek treatment for opioid addiction is not easy. We also know that finding the right doctor can be a daunting task. That's why we've made it our mission to connect patients with qualified Suboxone doctors online who can provide them with the care and support they need to recover. Our online platform allows you to search for doctors by location, insurance coverage, and more. We also provide helpful resources and information about Suboxone treatment. If you or someone you know is struggling with addiction, we can help. Contact us today to get started on the road to recovery.